Definitely can be frustrating for teachers and parents when they are trying to discover what is going on with their child or their student. And that's why it's important to understand that this is something that is beyond the normal age-related focus. Children have a smaller span of focus, and therefore it's important to notice that it's different than that this is something that's happening at home and at school. The two hallmarks of ADHD are inattentivity as well as impulsiveness. So the inability to focus and the inability to control your impulses. It usually happens around the third year of school is where we usually see it. Conventionally, medical doctors will give prescription stimulants and cognitive behavioral therapy as a therapy. In naturopathic medicine, we prescribe specific nutrients that are often deficient, like B vitamins, zinc, essential fatty acids. We help to identify some of the underlying causes of what might be some of the problems as far as identifying food sensitivity, so improving the child's diet, increasing whole foods, decreasing different types of food additives and food colorings, and then identifying if there are heavy metals involved. Like mercury, lead, and cadmium are present everywhere in our environment, and they also can be found in emissions from cars, as well as they're in our soils, in foods that we eat, and water that we drink.
Riley, one of Dr. Trebilcock's patients, came to her because his parents didn't want to treat him with conventional medications.
Riley initially presented to me because his parents and his teachers had recommended that he take medication for ADD, and they were looking for some sort of alternative prior to starting that process. So initially, we started with testing for food sensitivities. And food sensitivities, the most common food sensitivities for children in general, and especially children with ADD, are wheat, corn, soy, dairy, and nuts. And we did an individual blood test for him and identified probably about 13 or 14 different food sensitivities, and he has been avoiding those since. We also repleted some of his depleted nutrient sources with essential fatty acids. Essential fatty acids are very, very important for nervous system health. They are like the insulator for a copper wire. They help. That copper wire is your nerves trying to send transmission someplace, and the insulation makes sure that that is going to the right place.
I felt hyper and not healthy, and I got a little confused with stuff at school, mostly because I couldn't focus because there was too many kids in my class. She told me to eat more healthier foods like carrots and vegetables, and most likely healthier bread like wheat, not white, or any sugary stuff. When I was eating those kind of stuff, I was more calm, energetic, and I felt a lot healthier. And what happened was I was more focused, and nothing would bother me. When I used to do stuff, I would be not that good at it, and now I could play sports, I could do it a lot better. I could finish more tests. I'm getting a little more good grades, and it's easier to focus. Over Christmas break, I got off my diet. It's a little off track. I started to get a little more hyper, and my teacher noticed it right away. And I went back to school, and I did it again, stop eating bad food, and she was impressed.
He's been doing great. His gastrointestinal health has been improved, which helps him absorb the nutrients now that he is taking. His focus is much improved. He was threatened as far as having to skip a grade and go back, and now he does not need to do that. He is doing wonderful, and his teachers are always commenting on how well he has done and has improved.